All right, everybody. I think we'll get going. I think it's just 2 o'clock. I'll just say hi to everybody. And my name is Diana Hickey, for those of you who don't know, and I am the chair of the board here at Peninsula Health. And it's my pleasure to welcome you all here to the 2022 annual general meeting. It seems somewhat strange saying that in 2023, but you'll all get it in that we weren't able to sort of meet face-to-face for all this time. So we are having a face-to-face meeting here today, and it's the first time in 3 years. I mean, you can't believe that, can you? It's just gone by like that. So I'd like to extend a warm welcome to all of you and also to everybody who's online here today. So for the first time, we're streaming this online. So before I start proceedings, I'd like to acknowledge the traditional custodians of the lands where this health service is located. I'd like to acknowledge the Boonwurrung and the Boonwurrung people of the Kulin Nation and pay our respect to elders past and present and emerging. I'd also like to acknowledge representatives here today from local government and our tertiary partners in the Frankston Hospital redevelopment, which is a really exciting project. I'm sure most of you are up to speed with that. My fellow board members, the CEO, Felicity Top, members of the executive team, staff and volunteers. I've always wanted to do these speeches without paper, but I've never managed to be able to do it. At the conclusion of the AGM, we will hold our community forum, which is an opportunity for you all to ask questions and provide feedback on our services, and we do look forward to hearing that. It's very important to us. As I said, we are live streaming the meeting today, and the recording will be made available afterwards to everybody via our website, as well as through the intranet for all our staff here at Peninsula Health. So to start the official AGM proceedings, the minutes from the 2021 AGM have been approved and accepted prior to today's meeting. And I'd like to acknowledge our board members that are here today. So if each of them could stand up so you can actually have a look at their little faces and just maybe face the audience when I call out your name, I'd really appreciate it. So we have Alison Smith. We have Rita Kincotta. Now we've got Alison Dwyer online, so you'll have to wave to her online because she's not here in person. Karen Corrie. Kirsten Mander. Kirsten's down the back of the room there, even though she's got a seat up here, but there she is. Sylvia Hadj-Antonio. Hamish Park. And we have an apology from Professor Mark Frydenberg. So I'd like to thank all the board members for their significant contributions and expertise over the last year. And I've also much appreciated the passion and dedication each and every one of you have shown in your role as director. It's meant an awful lot to me, so thank you. So for the financial year ended the 30th of June 2022, Peninsula Health's operating revenue was $819,836,000, and the operating expenses were $819,582,000, which shows a small surplus of $254,000. The Chief Financial Officer, Pranay Lodya, will have more detail on this in a moment. So I'll leave that to you, Pranay. The financial statements have received an unqualified audit report from the Victorian Auditor General and fully comply with the Victorian Government's financial management framework. And for those of you who want to, you can review the full financial statements in our annual report, which is available today at the back of the room and also on our website. The past 12 months have once again been extremely difficult for everyone associated with our health service, including patients, their families, staff and volunteers. The reporting period for our annual report included the 5th and 6th lockdown periods for Melbourne, as well as the first Omicron wave of COVID-19 and the subvariants which followed it. I found it really hard to keep up with them all. There were so many of them. As we look back over the past year since we held our last AGM, it is a chance to consider how much the pandemic has changed our lives and how we continue to respond as an organisation to ensure each and every person receives the best care. Our improved knowledge of COVID alongside the vaccination programme has aided us in managing the inevitable waves of the virus. We are now much better placed to restrict the spread, therefore delivering better care for local people. Throughout the pandemic, staff have been extraordinary in their commitment to provide the best care, and on behalf of the board, I want to thank each and every staff member for their efforts over the last 12 months. You've been absolutely amazing, and I know with the shortage of staff and everything else, it's been a really difficult period. So I really want to thank you. So thank you on behalf of the board. Our values of being the best, being a role model, being open and honest, being compassionate and respectful, and being collaborative are incredibly important to the board and to all of staff here. We believe that the behaviours and values drive the vision of providing exceptional health and community care to our community. And I know we had the recent accident when the piling rig went into our mental health unit, and we had to sort of find places for some of the patients in our mental health unit, and the collaboration and the partnerships with community, with parents and families, with the private hospitals was next to none. We could not have done it had we not had those unbelievable relationships. So all those values that I've just spoken about, we live and breathe them and believe that they are the key to being terrific with our health services. And I'm particularly pleased today to welcome and commend our inaugural Values Awards winners, and many of you whom are here today. So we've actually looked at our staff and said, you know, you're pretty terrific here. You're a role model. You're the best. You're an example of being collaborative. And, you know, it is wonderful to have people that are champions and believe in that stuff. I'd also like to thank our executive team and our CEO, Felicity, who has continued to work tirelessly in leading our response to the pandemic. And in addition, the team has managed to maintain the focus on the delivery of our goals and objectives and our plans and our strategic plan. And the work to develop the next plan will start later this year, so I'd like to take the opportunity to recognise the professionalism and commitment of our executive and senior staff in continuing to move the organisation forward despite all the challenges they have faced. And finally, to more than 700 volunteers who selflessly invest their time and expertise for the betterment of Peninsula Health and the local community. Our volunteers, auxiliaries and consumer representatives are critical to the successes of us as a health service. I know many of you have already returned to duties on committees, the wards and across our sites. For those who haven't yet returned, we're looking forward to welcoming you back. And I had a little request from a woman who was sitting beside me today, and I thought, well, I'll just add it into my chairman's report, because I can. And Karen Scott, who's the vice president of the Pink Ladies Auxiliary, said, look, we desperately need volunteers. We have halved our volunteer base since COVID. People retired, people went. And so for all of you here in the room, if you only ask one person would they like to commit a couple of hours, you know, they're in great need. And you don't have to be a pink lady, you can be a pink man, I'm told as well. So please consider putting yourself forward. And the last thing I'd just like to let you know is that this will be my last AGM at Peninsula Health, as after 6 years I've decided to stand down as chair of the board, and I'll finish at the end of June this year. And another director who's online today, Dr. Alison Dwyer, will also finish up in June. I'd like to take the opportunity to thank Alison for her exceptional contribution and the expertise she brought to the board in clinical governance. Thank you, Alison. So all the other directors will continue in their roles, and can I say they are without exception some of the most skilled directors I've ever worked with. So you're a very lucky organisation. They are fantastic. So, and I know this great organisation will continue to strive and grow over the next few years. And 2 additional directors will be appointed in the next few months. I've thoroughly enjoyed my role, and I'm very proud of the many achievements of Peninsula Health despite the difficult times, and Felicity will talk later about some of those achievements. And I'd now like to welcome our Chief Financial Officer, Pranay Loidier, for the financial report. So thank you, everybody.
Thank you, Diana, and good afternoon, everyone. You have me for the next 2 hours where I'll go through a 3,000-row spreadsheet in 8-point font. So now, last year was a positive year financially for Peninsula Health, with a growth of revenue hoping to deliver a favourable outcome for the 12 months to June 2022. Despite a decrease in equity due to the growth in liabilities outstripping assets by 10 million, we had a positive result. As Diana mentioned, for the 21-22 financial year, we recorded a surplus of $254,000, which in another extremely challenging year is a pleasing outcome for the health service. And I just want to take a moment to acknowledge all the staff and the executive and the managers who've worked hard to contain the budget in a very challenging year. So thank you very much. The COVID pandemic continued to play a key role in the organization's financial performance. The resulting effects of the pandemic again had to be negotiated as the necessary response and resulting effect on services and procedures affected almost every item on the operating statement. The health service was faced with a number of significant challenges as lockdowns continued through July 2021, and then again from August to late October of that year. Our requirement to care for an ever-changing number of patients with COVID-19 alongside the infection control measures in the hospital had a significant impact on the number of patients we were able to treat, as well as surgeries we were forced to postpone. The acquisition of Frankston Public Surgical Centre had no impact on the financial performance of Peninsula Health in the reporting period, as we did not take over the management of the facility until September 2022. Outside our hospitals, our pandemic response has seen us continue to invest significantly in direct services for the community. Our commitment to providing exceptional community care is highlighted through programs such as Better at Home, the High-Risk Accommodation Response, and the Smile Squad. Collectively, in excess of $46 million was spent on various community health initiatives. We continued to invest in key capital commitments, notably $1.3 million for the Tarnberg Centre on the Nepean Highway in Frankston. $1.2 million was invested in the redevelopment of Rosebud Cancer and Clinical Trials Hub, $2.1 million on essential cladding works for the Frankston Hospital. Further to the capital commitments, investment was also made in a new learning management system critical for the contemporary training of our people. Overall, our investment in new capital assets grew by $27.7 million. It is particularly pleasing to see stability in the bank balance sheet ratios as we again returned a small surplus in another challenging reporting period. Some other points to note: we maintained and further invested in our work from home program, ensuring that all staff who needed to work from home had access to the most efficient technology. The COVID-19 vaccination program directly affected operational and staffing costs throughout the period while this critical work was undertaken. The Frankston Public Surgical Centre is expected to deliver a significant increase in activity, but also has added staff, equipment, maintenance, and IT costs, which will continue to be adjusted over the coming months, impacting the 2022-23 result. There is far more detail on the Peninsula Health's financial position for the reporting period up to now, and including 30th June 2022 in the top 10 bestseller, the annual report, which is available at the back room and also on our online website. Thank you so much, and thank you to all the staff who worked hard over the period and to deliver the result. I will now hand over to our esteemed CEO, Felicity.
Thanks, Pranay, and it's always hard to find a CFO with a sense of humour, so it's terrific to see you all here today, and welcome to all those people who are also joining us online. Before I start, I'd like to acknowledge the traditional owners of the land and where we're meeting today, the Boonwurrung and Boonwurrung people of the Kulin Nation, and pay respects to elders past, present and emerging. I'd also like to take this opportunity to welcome board directors of Peninsula Health and our past board directors, because I noticed Nancy Hogan was here earlier on. Hi Nancy, great to see you here, a continued supporter of our organisation, thank you. All our community supporters that do so much for our organisation. Our staff, they're unbelievable. You have got no idea the effort, the work, the teamwork, the sensational care that they're providing at Peninsula Health. Absolutely acknowledge those that are here with us today, but all those I know who are back at many campuses caring for our community. Volunteers and community representatives who are here with us today, who have also done an enormous amount of work and continue to support us over trying times. Our continued support from government, both federal, state, local, our partnering universities and TAFEs, our building partners who are here today, the Department of Health, Victorian Health Building Authority, all who are doing a tremendous amount of work in developing and growing Peninsula Health. As Diana said, I will be running a community forum later on. It's my favourite part of the AGM actually, is where we get to take questions from people who are with us today. But can I also acknowledge people who are joining us online to drop questions into the chat section of the platform, and we will certainly be able to answer those questions. So, 19th of February 2018, 5 years ago, almost to the day, was when I started at Peninsula Health. And there is no way I would have thought that the experience that I've had over the last 5 years would have been the experience that I've had. There's been an enormous amount of growth in our organisation over that time, a pandemic, and that pandemic has driven a number of significant changes in our organisation. But before we start, I'm just going to dwell on our staff for a little bit longer. We started off with 3,500 staff back in 2018. We're over 7,000 staff now at Peninsula Health. Every day I'm reminded about the great care and efforts that our staff put into our community. During the pandemic, there was nothing that got in the way of our staff trying to find solutions on how we can continue to provide care. With that in mind, there were so many new innovations. I can still remember having those staff meetings when everybody was at home on the telephone. And so everybody would be dialing in on the telephone, and the only way I could ask for people's questions was by going through the alphabet. I'd have 700 people on a telephone call, and we'd go, anybody who's got a question whose name starts with A. Anybody who's got a question whose name starts with B. Now, we did it and we got through those questions, but in a very short period of time, we're on Teams, we're on Zoom. It is normal. We won't be going back. But that technology has just driven some great innovation in the care that we provide to our people. So care in the home has been a big focus. Our community health team, and Fergus down the back, who leads our Director of Community, we were caring for people, over 1,000 people in the community in our COVID care pathways. That technology and how we care for those people in the home is continuing, and will continue further. We've now got our virtual ED program where we work with our paramedics from Ambulance Victoria, where they will go out to a home and they'll call in to our team and talk about the care that's required for that patient. If we don't need to take the patient to the emergency department and we can get care out to people's home, then we will. We've seen some fabulous stories of how we've been able to get people who would not normally be able to go home. You know, people who are dying, or people who have had significant strokes or are really unwell. We've been able to get those patients home, and with support of allied health, doctors, nursing, community supports, we've been able to care for these people home, which is great for those families, great for the patients, but also great for our healthcare system. And we'll see more of that work that when Shrikant gets up and talks in a moment. Even through the pandemic, we have done an amazing amount of work with our building partners. The Frankston Hospital redevelopment, which was announced for funding in June 2018, we've now started digging the foundations for that fabulous building. It's $1.1 billion worth of capital infrastructure being built in Frankston for the Frankston-Mornington Peninsula community. It is going to change the face of Frankston. It is going to be a state-of-the-art building. It's going to provide employment over the next 3 years for over 1,200 people. It'll provide future employment for an extra 500 to 600 clinicians. It's going to be a fabulous building. And can I just thank all the staff and our building partners. I've got the CEO of Exemplar Health here today. It's such a great project. It's going to be such a great project for our community. And I went out to some kids last year and talked to them about the opportunities on the Mornington Peninsula. You will not have to leave Frankston, Mornington Peninsula from the day you're born to the day you die, because you can grow up here, you can go to school, you can go to university, you can go to a TAFE, and you can work in a health service. And you don't have to just be a doctor, nurse or allied health, but we've got an extensive IT team, we've got a finance team, we've got people and culture team. You can almost do whatever you want to do in our community. And I think that's really important to change the face of the Frankston Mornington Peninsula. It is a place to grow up and to live, and it is thriving, but I think we're going to see a real change in the coming years. One of the other things that I'd say we're absolutely proud of that we've been able to achieve in the last few years is the development of our research program. And Srikanth, who's here today, who's our Professor of Medicine and Director of the National Centre for Healthy Ageing, is going to get up and talk about some of that work. But it was a vision. It was a vision that we had with Monash University, with Peninsula Health, on coming together to create a facility, a great facility where clinicians, university people can come together and really start researching for our community. The translation work that our team are doing on ageing is world leading, and I think we're just going to see more and more work come out of the Narungga Centre, which is the new centre that we opened last year, and we're going to see some great things in that area with the team that Srikanth is leading. Finally, I just want to pay tribute to our volunteers. They don't let us down. They're always there. The Pink Ladies who had to close down because of COVID. How many years, Carol? You must have been out for 2.5 years. I can't. 2 years, 3 months. Carol was counting down every day, and so were we. I can still remember when they opened up, and I don't know, most people know Frankston Hospital. There's that long corridor where you see the Pink Ladies Cafe, and I can tell you it just lifted the spirits of our organisation when the CAF and the Pink Ladies were back on site. And they're remarkable, right? So they're cashless. And that was we had to get them to go cashless, hey, because nobody else carries cash. So the Pink Ladies weren't going to be able to do what they do unless they went cashless. So they've had to change their model, like everybody else has had to change the way they've worked, and they have just been fantastic in the way that they have responded. And every day we're grateful for the work that our volunteers do. Before I finish, I just want to thank board directors. It's been tough, eh? It's been a tough, 4 years, 5 years, but certainly over the last 12 months. It's been difficult to keep our focus on our strategy, on our care, but also, importantly, on the well-being of our staff. And after 3 years of pandemic, it's got incredibly difficult to keep everybody motivated and engaged in the work that we do. The board have been right behind me. They've always been there to support myself and the executive, and can I just thank you all. Also to acknowledge Diana. I know she doesn't want to make a big deal that she has decided not to continue on as board chair. We'll have greater celebrations towards the end of the year, but been a great support, Diana, and yes, I will certainly miss you in that role. Before we hear from our Community Advisory Committee, Pauline Dastily, I mentioned some of the capital projects we have been working on, and one of those is the Tarnbuck Centre. Now, the Tarnbuck Centre is a place down on Beach Street in Frankston that we have had our building team, and Bridget and the building team have done a great job in developing for our Frankston community mental health and alcohol and other drug teams, and we thought we'd just show you a quick video of the Tarnbuck Centre. So I hand it over to the team.
It's so great to be here at the newly opened Tarnbuck Centre to really acknowledge and act on one of the key observations and recommendations of the Royal Commission into Victoria's mental health system.
Tarnbuck, the name, was given to Peninsula Health by the local Bunurong Land Council to get up and stand up and basically to heal. That is the meaning of Tarnbuck.
This centre provides us the opportunity to bring a couple of our services together within Peninsula Health. That is our mental health service and our alcohol and other drug service. By bringing them together, it provides us the opportunity to have more clinics, run more services, and a much more welcoming space for clients and their carers to come in and spend time with us.
This building and the refurbishment that we're here to celebrate today represents a lot of hard work by a lot of different people and a key partnership between the government and Peninsula Health. Government can't do this alone. We rely on our partners like Peninsula Health. We rely on the workforce to deliver this change on the ground, and of the commitment of so many people to making sure that we can deliver a mental health system that best meets the need of our community.
It really is a great centre, and I've been down there a few times, and it's just, you cannot underestimate what a good environment is for both clinicians to provide care, but having a great environment for community to come in and have that therapeutic care is also important. So the Tarnbuck Centre for our clinicians and for our community is great. I'd now like to invite Pauline Dastily to come up and give her reflections on the last 12 months. Pauline is one of our most valued volunteers at Peninsula Health, and has also, Pauline, been the chair of our Community Advisory Committee. So thanks, Pauline.
Mr. Akanth has many, many abilities. Muscles. It's exciting, and it's a privilege to join with our Peninsula Health family, both face-to-face and with our online attendees, in my role as outgoing chair of the Community Advisory Committee. Almost 21 years ago to the day, I was right here in this room for the presentation of the Mornington Racing Club Lifetime Achievement Award to my late father, Jim Houlihan, a rising 89 years old at the time, and yet still a successful licensed horse trainer. So this was the trophy. It weighs a tonne. Today, Dad would be delighted that Peninsula Health is holding the AGM at Mornington Racecourse, and he would be most interested in the work of the Director of Happiness at Peninsula Health, this chap, Kenzo. My family holds memories of a pre-pandemic, more relaxed era in healthcare. My sister would bring her Jack Russell dog Bella to Rosebud Hospital for family visits to Dad. Bella was never on a leash. She greeted staff and other patients on her rounds and hopped into bed with Dad. His spirits lifted immediately. When asked by staff, "What's your dog's name?" my sister replied, "Nurse Betty." Our Nurse Betty knew how to provide person-centred care. 4 generations of my family have been or are under the care of Peninsula Health in times of good health outcomes and worrying times of terrible illness. Health begins in the family. My late mother, Molly, would quote to us, "Health is a jewel on anyone's head, but only a sick man can see it." I wonder if the pandemic has made us reflect more on this jewel and the centrality of Peninsula Health in our lives. As community members, each person has significant lived experience to offer Peninsula Health working on service improvements. For me, as a mental health carer, It is my purpose to contribute to the transformation of the mental health system. Despite the disruption of the pandemic, our Community Advisory Committee continued to meet online. We met every second month for 2.5 hours. We had developed a work plan and worked productively as a team. Our CEO Felicity, board members, executive, staff and consumer advisors all enthusiastically attended Community Advisory Committee meetings. We made it happen on Zoom. Our ideas mattered. Some highlights were the input we had on the MEPAC's personal alarm system, reviewing our community advisory groups, mindful of the needs of our diverse community and people on the margins, website development, hospital in the home, Frankston Hospital redevelopment project, and importantly, we developed the Peninsula Health Consumer and Community Engagement Framework. We have opportunities to co-design services and solutions as partners in improving the quality and safety of Peninsula Health services. We are at our best when we serve, and serve with love. Thank you.
Pauline, I know you're not expecting this, but I did just want to say thank you very much for being our Community Advisory Committee Chair for a number of years. You're a great supporter and a great advisor to me as a Chief Executive, the board and the rest of the organisation, so thank you. Thank you. I'll leave it. Yeah, I'll give you that. So, as I mentioned before, one of the key areas that has been steadily growing through my time here at Peninsula Health has been the development of our research and our research program. And pivotal to that is actually having some space and having a purpose-built design space where people can do research, develop ideas, and really promote that area of thinking. So in partnership with Monash University, Peninsula Health and Monash University committed funding to build the Narungga Centre. Hear and listen. Narungga is hear and listen. It's about new ideas and innovation. Before I get Shrikant to talk, I think we've got a bit of a video on the Narungga Centre. Thank you.
Well, we've created a national centre for healthy ageing, but it's based here on the peninsula, Frankston, the Mornington Peninsula, an older population, a natural place for research, for treatment, for support. And with the quality of Peninsula Health and Monash, the lessons go not just for the peninsula, right around Victoria, right around Australia, and potentially right around the world.
The aspiration for us is to have work that's done that's impactful at a global level. So really make a difference for people in healthy ageing right through the lifespan.
The name was chosen from the Bunurong and the Bunurong land custodians of this area. It means to see and understand. That's the reality of truth telling, isn't it?
So to talk a little bit more about the fabulous work that's happening at our Narungga Centre, I invite Professor Valendai Shrikant, who is our Professor of Medicine and the Director of the National Centre for Healthy Ageing. Thanks, Shrikant.
Thank you, Felicity. Thank you to the board, the executive, and the members of the public for coming and listening to me today. That is the front of the Narungga Centre, and as Felicity said, it came from some thinking over the last 5 to 6 years to start to build some research capacity and provide a facility for us to work in and develop ideas and innovate. And I see Nancy Hogan here, who was chair of the board at the time when the ideas began to take shape and then have proceeded to come to fruition late in 2021. So we moved in 2021 into this building. It is actually a fantastic and a fabulous building to work in, and many of our colleagues who work with me are here today. Now, before I go on, the top 5 bestsellers amongst the top 5 bestsellers, not the top 10, is the research report. It's out there in the front of the back room for you to look at. Please have a look at that on your way out. The good news is that research at Peninsula Health is actually flourishing really, really well. It's come in leaps and bounds over the last 5 to 6 years. It's innovative, meaning the ideas that are coming out are really new. It's impactful, to suggest that these ideas have an impact on the health of our community in some real and tangible fashion. And it's got an exciting future, which relates to what Felicity said, is that we have Commonwealth funding that's setting us up to be a truly national centre in the future. And this is because there is commitment. There is commitment from the people who do research. There is commitment from the staff who are engaged in our clinical work, who support the people doing research and give them ideas. But importantly, there is commitment from the board and the executive in partnership with our university affiliates, Monash University. The key thing here is our work centres around people from the community. Our ideas are generated from people who have lived experience with the kind of conditions that they are facing, and they drive the kind of ideas and the priorities that we deal with in our research. So research is flourishing, and I can show you some statistics here which are fairly easy to look at. Research is growing in almost every department in our organisation. If you look at this particular bit here, one of the primary ways we determine how well we're doing in research is how many peer-reviewed research publications we've generated. And that's an easy thing to see. So from 2019 to 2020 to the last year, there's been a doubling of how much we put out there. Funding, the kind of funding that we've got outside of the funding we've got from the Commonwealth, has also doubled over that period of time. But these are statistics that they're easy to see, but they are a bit abstract. So what I'd really like to do is show you some examples of what we're doing. If you take heart attacks, one of the single most important conditions that affect people through most ages, our organisation, led by our cardiology team, has come up with a very simple and new idea, repurposing a medication that's used for gout, colchicine, to treat and prevent heart attacks. And this has now taken on national profile, is changing guidelines across the world. Our Cancer and Clinical Trials Unit have moved forward in securing some large funding from the Medical Research Future Fund in collaboration with the Alfred Health, and they've set up a Cancer and Clinical Trials Hub in Rosebud, so creating access to new and improved drugs across the peninsula, not just at Frankston. Surgical teams are not left behind, and our surgical team is particularly innovative. They're beginning to deal with some of the most complex problems, the simple problems we think that affect us. Hand arthritis, I'm beginning to get aches and pains in my thumb, and I'm sure many of you will have that. How do we treat that in the longer term to protect and prevent against disability? 3D printing is a technique that they've used. They're developing implants of the bone that's affected in the arthritis, which will soon be in clinical trials from here. But then coming to the whole question of aged care, which is really where we're heading in terms of our focus and priorities in our research. If you think back during the COVID years, 2020 and 2021, in 2020, I was at the coalface of organising services and healthcare for people coming in from residential aged care to our hospital services with COVID. And at the time, it became painfully obvious how things had to improve in the way communication happened between residential aged care facilities, hospitals, and back. So what we're now doing is trying to bring everyone to the table, including the person who lives in the facility and their carer or next of kin, to design a solution for transfer of critical information when they move from one place to another that is simple and that the families can look at. So this is going to be quite transformative, and the Commonwealth is really interested in how this might change national practice. So with the expertise that we developed over the last many years, the Commonwealth Government decided to provide us with $32 million to set up the National Centre for Healthy Ageing, and this was with bipartisan support from both sides of politics. So in 2019, the funding was awarded and the ground was broken, as you can see there. And by 2021, in spite of COVID, people worked really hard, and I thank some of the people here who really drove the project. The building came to fruition and was opened in 2021. 2022, it's almost fully occupied. It is a primary centre for teaching, education, and research where people get together and collaborate. What are the kinds of things that we're doing there? So with the National Centre, with a lot of workshopping and getting together with community, with researchers and clinicians, these are the big themes that we're thinking of addressing over the next coming decade. Our intention is to look at healthy ageing across the lifespan. As someone said just before, it starts from early life, the whole prospect of preventive ageing, and looking after people as they get diseases later on. We are going to address two primary themes. One we call optimizing health, and the other is health and social care. In this theme, our main challenge is how can we improve and maintain people's health and independence in their own environment, help them thrive in their own environment. And what Felicity said before, how do we care for people at home? So new models of care that we're developing are going to be tested within the National Centre that are nationally relevant. The other thing is how do we develop systems of care that respond effectively to increasing complexity of people's needs? How do we pull together the disparate systems of hospital, residential aged care, community care to serve the person when they most need it? The kind of projects that we're doing are going to be built around mining big data sets that we already have, routine data that we're collecting, to try and feed into the models of care that we're developing and testing. So I hope to see in the next 5 to 10 years a lot more to tell you every year in this journey, and I thank everyone who's helped us go ahead with it. Thank you.
Thanks, Srikanth. And every time I hear you talk, I get more excited about the things that are happening in our research program. And it's kind of interesting, isn't it? We do our research week, and I'm often just astounded by the quality of research that's been done in our organisation. I think Pranay mentioned earlier on that we acquired Frankston Public Surgical Centre towards the middle of last year. And I'd like to thank the state government and the Department of Health in helping us secure that building. It is providing us an extra, currently 3 operating theatres, but by the time we're finished doing a small redevelopment in there, we will have 5 operating theatres that essentially is separated out from any emergency department. So it will be solely dedicated to planned surgery. To date, since we're open since September, I think, doing work, we've done over 1,300 planned surgeries, and we certainly plan to do many more surgeries for the community of Frankston and Mornington Peninsula. So I just thought we'd do a quick video of the centre. Thanks.
I'm here today inside the recovery area for the new Frankston Public Surgical Centre for the community, where we'll be performing thousands more elective surgery cases. We've been fortunate enough to just have the Premier of Victoria down, along with the Minister of Health and our local member. They've been down to officially open the facility and welcome our first patients into the facility as they come to get their surgery.
We have a number of patients on the waiting list, and as you're aware, over the last 2 years elective surgery has been restricted, and this is a fantastic opportunity for us to increase the elective operating up to 9,000 cases a year. Staff have transitioned across to the Frankston Public Surgical Centre and will be joining the Peninsula Health family and working with us as we tackle the elective surgery waiting list.
From the board's perspective, we are so excited about the opening of this Frankston Public Surgical Centre, and we are really thrilled that many of our patients on the waiting list who've been waiting a long time will now be able to have that planned surgery.
Thanks, and I'll hand back over to Diana now, who's going to present our Life Governor Awards. Thanks, Diana.
Thanks, Felicity. So an incredibly important part of our AGM is the recognition of our new Life Governors, and these special awards recognise those people who've provided 10 years of voluntary service to Peninsula Health, a fitting acknowledgement for our wonderful volunteers, and this year we have 19 awardees. So it is a great privilege and pleasure for me to be able to recognise our Life Governors at the AGM here today, and your dedicated service is greatly appreciated by us all. Before we recognise them, we've created a short video with some reflections from some of the recipients, which we will now share with you.
I volunteered at Peninsula Health for 15 to 20 years, and I've enjoyed my stay, and hopefully I can keep going until I'm 100.
I think the feeling that you're actually doing something for other people, where during your working life you're doing it for yourself because you need the money to keep going, but once you're retired you've got the time, and it keeps you active as well, and you meet a lot of people. That's what I like about it.
My wife had breast cancer. She treated her for 14 months and everything was perfect. Why? So I give something back.
It's nice to be heard, and when you see things happen that the group has put together, it's quite exciting, really.
It was really exciting when we got the phone call to say that we could again start coming back to doing pet therapy. It was just happiness all round, and we even got caught coming in and they're back. So it was a wonderful experience, happiness everywhere.
Call up the people that are here today for those awards, and maybe you could show your appreciation as they come up to collect their certificates. So I'll just come down and call out the people's names on the here, I think. So first we have Horatio Diaz. Congratulations, fantastic. There you go. Not at all. Thank you. Next we have Yvette Harrison. Congratulations, Yvette. Well done.
Thank you. Thank you.
Sandra Jeffrey. Take your time. Congratulations. Thank you for your work. That's been fantastic.
Thank you so much.
Judith Johnson. Congratulations, and thank you for your contribution.
Thank you.
Norman Jones. Congratulations. Thank you very much. Peter Rice. Congratulations, and thank you for your contribution. Thank you. Judith Chappell. Thank you so much for your contribution. Thank you. And John Wilson. Thank you, John. Thanks for your contribution. Much appreciated. And I'll just acknowledge the remaining life governors who can't be here today, but I will just call them out, and they will all receive their certificates as well. We've got Janine Bernie, Carol Dickman, Angela Fung, Trevor Gilbert, Julie Ides, Elizabeth Johnson, Denise Martin, Glenys McGowan, Faye Norton, Audrey Tarquinio, and Graham Wood. So please join me in thanking all these people. And that actually concludes the formal part of the AGM, and I'll hand back now to Felicity Top for the community forum. So thank you, everybody.
Thanks, Diana. Now, I know the team want me up on the podium, but team, I'm going to stay on the floor because I prefer it that way. So anyway, I'm opening up for questions, really keen to hear from people who are here today, but also from people who are online. And I know the team are going to be putting out some questions on my mobile, so I'll keep an eye on those questions as they come through. But please feel free, anything that you've heard today, anything that you've heard in the supermarket or in the doctor's surgery that you want to ask about Peninsula Health. We've got some roaming microphones. I've got one that's come through. I'm going to start off because they're coming through. So I've got one, what's happening with the redevelopment of Rosebud Hospital? We have finished the business case and we really worked hard to get that business case in front of government before the election. We haven't actually been funded at this stage, so we're going to continue to work with government and the community in advocating for the redevelopment of Rosebud Hospital. We have put the clinical trials centre down there, so we've acquired the doctor's surgery next door to Rosebud, which has allowed us to expand our chemotherapy centre, which is fantastic, and the people who are having cancer treatment really deserve having that bigger, better space. And we are now able to offer clinical trials to people on the Mornington Peninsula without them needing to come up to Frankston. So it's a great development. Being able to move the chemotherapy out has allowed the dialysis team to have a bit more space, which they're very happy about as well. But it hasn't negated the need to redevelop that site. Here we go. Can I get some microphones over? Thanks.
Felicity, I'd like to just ask, a lot of people are dying sadly, and because of COVID and its restrictions, it's making it really difficult, and the empathetic part is difficult for families to adjust and accept. Is there any way perhaps incorporating some kind of technology where you could have a video call with your friend, partner, loved one who's dying? Because of the restrictions, you can't be by their side. And I think this is a very important part of life. Trying to say goodbye to your loved ones and not being able to be there is really horrendous. I've experienced it personally, and I've had a lot of people ask me that question.
Yeah, it has been really a difficult time, hasn't it? Especially during those lockdowns when we haven't been able to have visitors and community. We do have the technology, and we've had staff, we've had a lot of concierge staff out on the wards helping our patients communicate with their loved ones, but it is difficult because some people cannot hear well, cannot see well, so that is difficult. We have opened up our visiting hours now. There's less restrictions. Can I just point out though that COVID hasn't gone away, so COVID is still very much part of us, and we're still being very cautious about how we manage COVID. So visitors coming in, we're still asking to wear masks, and our staff are still wearing masks to protect our community. But you're right, wherever we can, we'll use technology. The good thing is that we're building the technology into our new hospital, so that's great. and that we're certainly taking the learnings of the last few years in the design and development of the new hospital. So there'll be fresh air in the rooms. There'll be 50% of the rooms will be single rooms and only double rooms or single rooms, not 4-bedded rooms. There'll be minimal bathrooms. So our ability to manage infections will be far greater in a new facility.
And perhaps acoustics considered as well.
The what, sorry?
Acoustics in the room. You know, some people in some cultures, people cry and it can be really noisy for the other patients.
Yeah, that's
so
right.
taking that into consideration.
Yeah, that's right. There was a few other hands up there. Hello.
Thank you for the opportunity to speak today. My name is Bruce Barnes. I'm a volunteer at the Men's Shed. Since the pandemic, we have been closed. And during that time, I've been in contact with many members, volunteers and participants. The participants we help who are both physically or mentally disabled, that is where we get our pleasure from as volunteers, helping these people. My question is the shed going to continue as a men's shed? And if not, will it be open? And if so, when will it be opening again? I see the volunteers elsewhere are back on duty, but our volunteers have been not able to return to the shed. Can you please help me in this situation? Thank you.
Thanks for your question, Bruce. And I've got Helen here, who is our Executive Director who's overseeing the community health. So I'm just going to hand over to Helen, who I think knows a bit more about the men's shed.
Yes. Hi there. Yes, I'm Helen. Sorry, I didn't see who was asking the question, but thank you. Thank you for that question. Very timely as well. We've been doing a lot of talking about the men's shed and future of the men's shed, so it's very topical. At the moment, we've got people using that space for our crisis assessment team for mental health, as we've had to spread out with COVID. So we're just working around space and location. So I can't give you an exact answer today on the men's shed and when it will be opening, but certainly we can keep that communication going with you moving forward.
Thanks. And I think, Helen, you have raised a point that I raised earlier on, is we've grown from 3,500 to 7,000 staff in a few years. We haven't quite got our new building off the ground yet, and we're maximising every piece of space as well as looking for other spaces across the peninsula. So we have got our community crisis assessment team, mental health team in that space at the moment, and that's as a result of the issues that we have had with the building having that incident late last year. So I'm sure Helen and the team will be in contact with you. Other questions? I saw somebody else. No? Okay, my phone's gone off. There's another one here. When do you think there'll be another COVID-19 wave? Are you expecting the health service to be impacted? So we're anticipating and planning for COVID waves probably every couple of months. Like, COVID's not going away. What we are doing as an organisation is trying to have that not as impact us as much as what it has in the past. So having it part of our normal care delivery. I have to say, the people, we've had 2 wards. One ward's been the Bass ward, and I got a text message from Helen yesterday saying, we've got no COVID patients in the hospital. No COVID patients. Now, that's since, what was it, June, middle of June 2021, September 2021. No. And we said, great, donuts. And then an hour later, oh my God, we've just got another COVID patient. So it doesn't go away, but it's how we set ourselves up to care for those patients, ensure that everybody's safe, and to continue to provide care for everybody else. So that's certainly how we're planning. I suspect we'll have another wave, that's what the experts say, around March, middle of March. Let's hope it's not a big wave. Hello.
Hello, Felicity. Sally is my name. I've been telling people that Peninsula Health is building a $500 million redevelopment, but did I hear you say it's $1.2 billion?
Yeah, that's right.
So
So
I'm right.
it's actually, the actual capital cost, I should get Johan to answer this question, but anyway, Johan's our project. The amount of money going into building the hospital is $1.1 billion. But for the life of the project, it's kind of been built into the life of the project. So we're getting more capital and the running costs over the 25 years is actually less. So the tender was very positive for this redevelopment. The tender allowed many more scope items that were off the list into the list. So an example of that is it's a complicated build, and I've got Fiona McKerrow here who's leading from an exemplar health point of view. It's a complicated build because they're building a new tower block and connecting it to the old hospital. And one of the challenges we had is that we've got 10 operating theatres at the moment, and the development was going to afford us another 3 operating theatres. And connecting those 3 operating theatres from new to old was really hard. So the tender response that got over the line provided 17 new operating theatres in there. So we're getting, in the new tower block, 17 new operating theatres, which is fantastic. And with the operating theatres that we've got up at the Frankston Public Surgical Centre, we'll end up with 22 operating theatres on the Peninsula by 2026, which is brilliant. So it was a $580 million investment by government, but it's just kind of the way the PPP worked out, and it certainly worked out in our favour from a capital point of view. So it's great. So there's many more things, new kitchen going in, new beds. It's really going to be fabulous. Sorry, my phone keeps dinging, so there's another online question. Okay. There's so many questions coming through. Sorry, I'm just trying to see. Is there any other questions? Has taking over Frankston Private made a difference to the length of the waiting list? Yes, we can say it has. We're just starting, because our waiting list hit 6,000, is that right, Jen? I can see Jen up there, a bit higher.
Not quite 6,000, but it's certainly been trending down.
Yeah.
3,500 now, but it was well over 5,000.
That's right. Yeah. 1,300, over 1,300 in the new centre.
113 of those patients had their joint replacement surgery, which was one of the procedures that was affected with the COVID waves that we were cancelling patients. So 113 patients have had their hip or knee replacement since September.
Yeah, and Jen, while I've got you there, what's the experience of the staff coming over to Peninsula Health, and what's the experience of the patients who are using the centre?
For the staff, it was very seamless. Keeping most of the staff and their managers as well meant for a very seamless transition. I was based up there as well, so I had got to know a number of the staff. And, after 5 days of orientation to our services, we were able to open up the operating theatres and function and have patients come through having their surgery, starting with lap choles, hernias and joint replacement surgery. Patients have really enjoyed the environment. It's a quieter hospital. I know we're all aspiring to a quiet hospital, but the surgery centre is quiet. It certainly has that private feel about it. Majority of the rooms are single rooms, as you've mentioned. That's what we're aiming for in our redevelopment. And the space, it's a lovely place to work.
Yeah, it's great, and what a great asset for us to have for our public patients, Frankston Mornington Peninsula. Thanks, Jenny. Jenny is our director, you're general manager now of our surgery program. Any other questions? Yes, thank you.
Hello, my name is Nelly. You mentioned that the workforce went from 3,000 to 7,000. So I'm just interested to know if you saw movement from perhaps retired healthcare workers back into the system, or was it students from tertiary education that have moved into work quicker, or has to be relocation from interstate or regional Victoria?
Gosh, what a great question.
I'm from accommodation.
Yeah.
I'm just curious.
Look, initially we saw movement of people coming in from retirement to come in, assist, especially in that first year, 2020, where we had that peak. And we had a number of people come in and do some retraining to be able to be re-registered. I think as the pandemic's gone on, we've seen the trend the other way. We're seeing more people who are nearing retiring age decide have had enough and have retired. We've also seen a number of people reduce their hours. So I think there's definite fatigue across the healthcare sector, and there's a lot of work around too. So there's a fair bit of competition for work. I have to acknowledge the brilliant work of our students. So our registered university students of nursing have done a great job, our allied health assistants, allied health students, and our medical students. So not has it only been great for us as a health service, but it's been fantastic for the development of those students. And it allows us to establish those early relationships for those students. And we've just had an extra 100, we've had 140 graduates start in the last week. Last week they were all in the organisation doing all their orientation modules, and we had 40 plus interns start a couple of weeks. And today, how many HMOs did we have start? 350 HMOs start today. So it's a very busy time in the organisation. What I will say is we've got a lot of learners in the organisation, and that's kind of hard on all the other staff, but I just commend our staff who are there to support those learners, and you know, they are our future. And like I said, we've got great relationships with our universities and TAFE. The investment government's putting into supporting people to do their training through university. So we're hoping to be able to see and provide placement for many more students over the coming years. We'll need to, because we're going to need to be able to, I think we need an extra 500 clinical staff to run the new hospital on top of the staff that we have. So, good question, thank you.
This is about car parking. Oops. Will the normal car park things open at both hospitals, or what happens there?
Yeah, so, gosh, it feels like a staff meeting. Staffing and car parking, they're usually my hot topics in a staff meeting, I tell you. So, can I just say, boringly, but probably luckily, the very first thing that's coming out of the ground for the redevelopment is a new car park. I want to say 460 spaces. Sorry, 675 spaces. Thanks, Bridget. You've just got that number at the tip of your fingers. So we are building a new multi-deck car park, and that's the very first thing that is getting built. So, yeah, important for sure. But we do acknowledge the difficulties in car parking. And I've got Ginevra up in the back room from the committee of Frankston. And Ginevra, you've been on about car parking in Frankston ever since I met you. So yes, it is important, and we'll work with community as well. Any other yes? Sorry.
Hello. Just with regards to the existing car park, as you're turning left to go into our staff car park, there's only a very small section of road where you can turn left. And as you've, actually if you can turn left and go up, when you've finished work, a lot of cars are doing illegal right-hand turns to go on Hastings wrong. And so there's a group of us that are waiting for these cars to do illegal right-hand turns. Yeah. And then when they have an accident, again, we're waiting. Is there any plans for that area to be resolved?
It really does feel like a staff meeting. So, yeah, well, we've tried, hey? We've spoken to Vic Roads about blocking off the ability to go across that road, and we're unable to do that. So we are very much encouraging people to do the left-hand turn. I don't know why anybody would risk going over to that middle island and trying to do a right-hand turn.
But, you know, and yes, they are breaking the law, and yes, we continue to encourage people to do the left-hand turn. Bridget, does that traffic condition change with the redevelopment? I don't think it does. Bridget, who's director of our redevelopment.
Hi, I love the question. Definitely everyone should turn left only, no right. But unfortunately, during the redevelopment, we won't be fixing that because it is a council matter. However, we will be improving traffic flow on the site and redirecting traffic away from that where possible. So you'll see a slight improvement, but we are relying on staff doing the right thing.
Yep, like obeying the law. Any other questions? Are we all good? Look, can I just say thank you very much as the Chief Executive. It's been a great 5 years, pretty full on. Really looking forward to the next 5 years as we grow and develop the organisation. And I think I'm handing over to you, Diana, to close the day. Thanks.
Just closing to thank you all for coming today, and also hopefully you can join us for a few refreshments at the end here. That would be terrific. And for those life governors, if you're happy to have a photograph taken with your certificate, that would be terrific at the back of the room. So other than that, safe home, and thank you all for being here today.
Would you like to hand these?